you may have noticed that whenever discussion of single-payer healthcare comes up in this country, someone is likely to say, either from the media or the political world, that it's a nice idea, but we can't afford it. A new study suggests that perhaps even the opposite may be true, but that it is certainly affordable, at least in California. Our next guest was the co-author of that study. Robert Pollin is a distinguished professor of economics and co-director of that's a title, by the way, and co-director of the Political Economy Research Institute at the University of Massachusetts, Amherst, and he joins us now to discuss single payer. Bob Pollin, thanks for coming on the program.
Thank you very much, Richard, for having me on.
Oh, it's a pleasure. I think the study that you and your co-authors have written on the California single payer bill is a very important one. And rather than me summarize it and potentially get it wrong, just briefly, what were your principal findings on this?
Okay, thanks, and thanks for your interest. The study was commissioned by the California Nurses Association, who were basically the main proponents of the bill, which is called Healthy California Single Payer Bill, which has passed the California State Senate. It passed on June the 1st, which was literally the day after we presented the study. So talk about immediate impact. I'm not used to that. So it's still got a long way to go. It's got to get through the assembly and then the governor. Anyway, what are the basic findings? Well, first of all, we measured how much it costs to operate healthcare in California at present. And that number is roughly $370 billion, which is roughly 14% of California state's GDP. It's interesting, a lot of the publicity that's come out referring to what you just said, Richard, about how we can't afford single payer. There was an estimate by the staff of the Senate, State Senate Appropriation Committee, which put the number at 400 billion. And that's not that far off in some sense, but the main way, the problem was, it was presented that this is going to cost 400 billion, as if we were going to go from spending zero to spending $400 billion, whereas in fact now the state is spending $370 billion.
Well, and when you say the state is spending $370 billion, define, if you would, the state, because there's a point I want to get to here. Yeah. In the way the discussion gets misframed, in my opinion, right. And perhaps yours. What do you mean when you say the state of California spends, and that, by the way, that's $1 trillion every 3 years. We're not talking small change. What do you mean? Who exactly is paying the $370 billion?
Good point. So as it is, under the present system, where about 2/3 of the people in the state who have health insurance have it through private insurance. Nevertheless, 70% of all spending in the state on healthcare comes from public sources, either coming from the federal government, state government, or municipal government. So, we're looking at Medicare, Medicaid, or it's called Medi-Cal in California. We're talking about the subsidies from the Affordable Care Act, county government spending. All of that constitutes 70% of spending as is. So taxpayers are already paying 70% through their taxes. So effectively, we have a predominant public expenditure system, though the dominant form of insurance and control over the system remains in private hands.
And I would assume, Robert Pollin, that the remainder of the remaining 30% comes out of people's pockets in one way or another.
Of course, yeah. So it's either insurance paid for by individuals or through their jobs, the businesses, or some combination, or out of pocket, just out of pocket. And we're talking about people having high deductibles, having high copays, which gets to the point that one of the things we find is that in the state, there's 36 million people, and about 7.5%, 2.7 million, are uninsured. But another 12 million people are what we would call underinsured. So that's about 30% are underinsured, meaning they do have some form of insurance, but that their copays or deductibles are prohibitively high. So really making it extremely difficult for them to get the health care that they need.
Yeah, which, by the way, parenthetically, is one of the reasons why I get frustrated when people use the terms health care and health insurance interchangeably, because sometimes you can have one and not have access to the other. But, and again, we're talking with economist Robert Pollin about the economic impact of the California single-payer bill. So what did you find, given that very large number that Californians pay every year for healthcare costs? What did you find would be the impact of this, this single-payer bill?
So the fundamental purpose of single-payer is, single-payer sounds kind of bureaucratic, but the real point is to give everybody access to decent healthcare. So we could call it the Decent Healthcare Plan, Decent Healthcare for All Plan. Single-payer is just the administrative means of achieving that basic end. Now, so as I said, there's close to 8% of the population is still uninsured, and another 30% is underinsured. So almost 40% of the state's population is either uninsured or underinsured. So the first goal is to figure out what would it take to provide decent care, access to decent care for everybody. So the present system is we're now spending $370 billion to get decent care for everybody under the existing administrative structure. We do estimate would get us to $400 billion. So roughly 10% increase in costs to cover everybody. But we say that under the single payer measure, there are ways to get savings out of the overall healthcare system. And we say the savings could conservatively amount to about 18%. And the way we get savings are really four basic areas. Reduction in administrative costs, relying on the single payer as opposed to multiple payers. Secondly, controlling pharmaceutical prices. Third is controlling fees for doctors, clinics, hospitals, providers. And fourth is reducing inefficiencies in the system. So and by that I mean reducing the number of unnecessary procedures and improving preventive measures would be two of the big categories there. Adding all of those up, we think you can get 18% savings. And again, it's impossible to be precise about that, but we think that's a conservative number. So if we're right with respect to those savings, that brings the cost down from $400 billion to $330 billion roughly. So it's a system that's going to cost $330 billion, which is less than the $370 that the state is paying now. It's about 8% less.
So, and you also made an important point, and it's one that I remember, I fought hard to make this point working for the Bernie Sanders campaign last year when his single-payer bill was under attack. This is obviously, much more fleshed out. It's a fully described, fully detailed bill, and you were able to do this detailed analysis on it. But one of the points I also wanted to make that I thought was important from your study, Robert Pollin, is that family spending on health care will go down, according to your projections. Is that right? Correct?
And business spending. So if we just look at it, people say, well, how in the world does that happen? Somebody's got to be paying more if somebody else is paying less. Well, if we find that on average, the costs are going down by 8% relative to the present system, from 370 billion to 330 billion. Then on average, everybody spends 8% less. Now, it's, not everybody has the same reduction, but just if you keep that concept in mind, it becomes easy to understand how we get these savings. Now, what we find is that lower income families, people that are on Medicaid, for example, now, they will see relatively modest savings. We will have to raise taxes to substitute for the money that people are now putting into private insurance. So we have what we call a gross receipts tax on business that is a tax on everything, all the money that any business brings in. But we exempt the first $2 million is untaxed for all businesses, which means basically for small businesses, not a single small business will pay any tax on this. And then we have a 2.3% sales tax, but we exempt necessities. We exempt food, utilities, and housing. So again, lower income people are only going to pay a modest tax, if at all.
Yeah,
oh, go ahead.
I'm sorry about one of the reasons why I think this is so important is that, and this is getting a little bit afield from the perhaps the data or the estimates, but you've been part of these policy debates for years, and I want your thoughts on it. One of the things we struggled with during the primaries last year was that the Sanders campaign was attacked with the argument that if you enacted a Medicare for All plan on the average families, the family of four, their taxes would go up $5,000. Well, there was a actuarial study showing that the average family of four paid nearly $11,000 in out-of-pocket costs for healthcare. Obviously, that includes catastrophic events and so on. So wouldn't you rather pay $5,000 in taxes than pay $11,000 to private interests? But there seems to be an irrational, or I think it's irrational, but an argument that's, well, you don't want your taxes to go up, even if it will save you dollar for dollar a lot of money. Do you think that's do you think that has skewed this conversation at all?
Definitely. I mean, in California, which, has a dominant Democratic liberal majority in both houses of their government, the Assembly and the Senate. It has a progressive governor, Jerry Brown, somebody I've happened to have known for 25 years, and I've worked with him, and I've been in touch with him about this bill. Nevertheless, yeah, people, including Jerry Brown, he's on record saying, I don't know how we can afford it. And in my own conversations with him, I've said, well, look, give me a chance to work through the numbers seriously and then take a look. But the logic is pretty straightforward. The logic is if you can deliver a framework that is more efficient, more affordable, that controls costs, then you can cover everybody and still save money. And so, yeah, we find, middle-class families are going to do much better. We find that middle-class families, as a share of their income, are going to save between 3% and 9%, depending on what their present insurance arrangement is. So if you're paying out of pocket right now as a middle-class family or buying your own insurance, yeah, on average, you're going to save about 9%. That's a big deal. Businesses, small businesses that aren't covering their workers now, they won't have to pay anything anyway because they'll be exempt from the gross receipts tax. Let's say you're a small business that is covering your workers now, that they're buying insurance for their workers. Well, they're going to see their healthcare costs go down by 22%. Now that's massive for a small business. It is a windfall. Now for middle-sized businesses, we also find that they're going to see savings in the range of 7, 8, 9% relative to what they're paying now to cover their workers. So we find even the largest businesses that will pay the 2.3% gross receipts tax in full, even they will come out modestly better on average.
That was one of the, and unfortunately we're going to have to leave it here, but that was one of the striking, one of the things that struck me reading your report, Robert Pollin, was that, you see so many debates in California around taxation related issues, especially eventually being focused on, well, this will make California worse for business or more attractive to business. I would think that this bill, SB 562, California single payer, makes California a more attractive place for businesses.
Yeah, well, certainly across the board, that's what we find with this 2.3% gross receipts tax with a $2 million exemption. Small businesses are all exempt. In fact, and they're 80% of all business enterprises are going to be completely exempt. Another 10% that are medium-sized businesses, their average gross receipts now is about 3.1 million. So they only pay taxes on 1.3 million. Their first 2 million is exempt. So they're paying at a tax rate of 0.8%, less than 1%. The larger businesses will pay the full 2.3%. Most of them will still see modest savings relative to what they're paying now to cover their workers. Now, it is true, and I've had discussions with various people, there are probably some very large firms that have very few workers and big receipts, like, big tech companies that don't hire very many workers, but, have massive revenues. Those firms will probably face a net increase in cost because they aren't covering very many people.
Well, my reaction to that is good, first of all, and secondly, you and I know that small and that medium-sized businesses are the engines of employment growth. But unfortunately, we're going to have to leave it there. Robert Pollin, economist, author of this important report. Thanks for doing this work, and thanks for coming on the program.
Okay, thanks for having me on.